Spinal Care of Nevada, the sponsors of today's segment, focuses on modern, low-force chiropractic, and they are here to tell us about some of those long-term solutions. And joining us today is Dr. Tuck Kuzmic. Dr. Tuck, thank you for being here.
Thank you for having me.
So before we get into our demo here, tell me a little bit about your chiropractic office and what you guys practice over there.
Yeah, so we practice modern technique, and it doesn't involve as much popping or cracking. And if you are looking for that type of adjustment, I'm probably not the right doctor. We have many patients who suffer from migraines, headaches, neck pain, back pain, and knee pain that is so severe they can't contemplate just where they would be today if there wasn't an alternative method. So we use this thing called an arthrostim to apply a specific and gentle adjustment to the spine so that they can get the relief they desperately seek.
And you hear those stories of people having to go back to the chiropractic, offices all the time and having to return. Is that something that's common for you guys, or is it kind of a one-and-done type of thing? What's the process like?
So one of the keys to our success is that we do a very thorough 2-day workup. Day one, they're going to get a detailed history and an examination complete with digital x-rays. Now, these are the top films in our field today, and really more people ought to take them. They'll show us exactly where the problem is and how we can correct it. Day two, the patient will come back in, we'll have had time to review the images, and then if I can't help them, I'll send them to another doctor. But if I can help them, I'm going to spell everything out for them. How much time, how much cost, any out-of-network benefits their insurance gives them. Because the last thing a patient should have to do is make an important health decision without the complete picture.
So let's show everyone kind of your process. Show me how this tool works right here.
All right, I'll demonstrate on my friend here, who is totally not a former patient. So. The brain sits here in the skull, sends signals down the spinal cord, and exits out through the nerves. So if a bone goes out of place here, pinching the nerve, that's going to lead to things like headaches, migraines. So by adjusting here, a specific and gentle adjustment, we're able to reduce symptoms and improve function as well. Same thing here. You got that hump in your back, makes us look older. It also affects lung function. So by correcting that, we also get better breathing, better movement in general. Same thing with low back pain, leg pain.
And my mom actually has a slip disc in her back, and she's never found a solution for it. So is that something that you guys can work on too as well, people who have the slip discs?
Yeah, so like I said, we do a comprehensive workup for everyone that comes into the office. If their disc is so bad that they can't feel the lower half of their leg or they're losing bladder control, we'll send them out. That's something we can't fix. But if their back, the disc is so bad that it's causing pain and running down the leg, that's something that we can certainly take pressure off the disc and off the nerve.
Wow, well, Dr. Tuck, thank you so much for showing us and really putting into perspective what you guys do. And you have a special offer for our viewers, right?
Yes, so we are offering for the first 20 callers the first 2-day workup. Normally that's hundreds of dollars. That includes history, exam, and x-rays. It's only going to be $37. That's what we're going to offer for patients to take care of their lives, okay?
Well, Dr. Tuck, thank you for breaking all that down. And once again, we'll have all that information on your screen. Thank you to Spinal Care of Nevada for sponsoring this segment. Give Dr. Tuck a call at 702-566-HOPE. That's 4673. Or you can visit spinalcareofnevada.com. And don't forget about their special offer. The first 20 callers can go in and see Dr. Tuck for a 2-day workup, which includes history, exam, and digital x-rays for just $37. That is normally $180. So a great deal. We will be right back.